This is just a procedure that I do. This is a minimally invasive total hip replacement via a direct anterior approach. Most hip replacements traditionally have been done through an incision kind of in the back of the hip, and there's a newer technique that's done through the front of the hip. So what is the direct anterior approach? It's a minimally invasive hip replacement technique that allows the surgeon to access the hip joint without detaching any muscles or tendons. When we do a traditional hip replacement, we actually have to detach the muscles that attach to the hip and then try to repair them back. But a lot of times they don't heal, or the person will end up with a little bit of a limp, and also there's a risk of dislocation. So traditional hip replacement is a larger incision, and then the incision is, again, like I said, in the back of the hip, and there's quite a bit of disruption of tissues that are vital to the hip joint going that way. And doing it from the front, it's a smaller incision, and you don't detach any muscles. You kind of go between two muscles. The traditional hip replacement, there's a higher risk of dislocation, so you can't cross your legs. You can't bend more than a right angle, so sitting on low-level surfaces can result in a dislocation, and also pivoting onto your legs can result in a dislocation. And for a period of time, patients have to sleep with a pillow between their knees or between their legs to prevent the dislocation while they're sleeping. With the direct anterior approach, these restrictions are pretty much not observed. They're not required. And then other potential benefits of this technique is a shorter hospital stay, smaller incision, less disruption of the muscle, potential for less blood loss as well, and a quicker surgery, and also a more natural return to function. Any questions?